Hi, my name is Rakisha, and I am going to be completing my head to toe assessment skills video. I'm in the appropriate attire. I do have my badge visible. I have gone ahead and gathered my supplies needed. I don't have on any nail polish, acrylics, or jewelry. I do have on my shoes. I don't have a pen light, but I'll be using this pen as my pen light. Okay, I'll go ahead and get started. The first thing I'm going to do before entering my patient's room is I'm going to go ahead and I'm going to knock on that door. I'm going to wait to be let in. Once I am let into the room, I'm going to go ahead and I'm going to perform hand hygiene. So I do have my hand sanitizer here. I'm going to perform hand hygiene, and then I'm going to go ahead and I'm going to don on my clean gloves. Then while I do that, I'm going to go ahead and I'm going to introduce myself to the patient. Hi, my name is Rakisha. I'm going to be your nurse today. Can I please have you confirm your first and last name as well as your date of birth?
Yes. Curtis Clay, 11/3/87.
Okay, and then I'm going to go ahead and I'm going to check that information with my patient's wristband. So I'm going to go ahead and look at that. Perfect, and that information does match. I also want to go ahead and state that my patient did agree to go ahead and be on camera. So you want to let them know that you agreed to be on camera?
Yes, my name is Curtis and I consent to be on camera.
Perfect. Okay. So before I get started, I'm going to go ahead and I'm going to look at my patient. And from looking at my patient, he does not seem to be distressed or anything like that. And he seems very well groomed. Okay. At this point, I would go ahead and I would check my patient's vitals. I would say that my patient's blood pressure is 120/80. I'll say that his heart rate is 65 beats per minute. His temperature is 98.7, and his O2 is 99% on oxygen, on room air. Mr. Pitts, are you in any pain or anything like that?
No.
Okay, so my patient did go ahead and state that he is not in any pain. Okay, Mr. Pitts, so the next thing I'm going to do is I'm going to go ahead and I am going to examine your hair, okay? So I am going to have to touch you. Is that all right?
Yeah.
Perfect. Okay, so I'm going to go ahead and I'm going to examine your hair. Okay, my patient hair seems evenly distributed and there is no signs of infestation or anything like that, okay? Okay, so the next thing I'm going to do is I am going to go ahead and I am going to I'm going to assess your hydration levels. So what that is I'm going to go ahead and I'm going to pinch your neck and look for any tinting or things like that, okay?
Okay.
Okay, go ahead and sit up for me a little bit, please. Okay, I'm going to go ahead and pinch your neck right here. Do you feel any do you feel any discomfort or pain?
No.
Okay. Okay. So, my patient's skin trigger is non-tinting. So the next thing I'm going to do is I'm going to check my patient's skin. So I'm going to have you lean forward for me, and then I'm going to check. Okay, that looks good. I'm going to go ahead and have you go ahead and place both your arms flat for me. Okay, you go ahead and relax this one. Go ahead and turn a little bit. Okay, I'm going to go ahead and I'm going to have you place that there. Okay, now I'm going to do the same for your legs, okay? I'm going to go ahead and have you just hold right there. I'm going to lift your leg up just a little bit. I'm going to do the same to the other side, okay?
Mom.
No! Okay. Okay, so after checking my patient's skin, it is dry and warm, It is dry and warm without abrasions and what do you call this? Wounds. Okay, without abrasions and wounds, and his bony premises do not seem to have any skin breakdown. Okay, so the next thing I'm gonna do is I'm gonna go ahead and I am going to look at your face, okay? If I could just have you go ahead and look at me, please. Okay. Eyes are symmetrical. I'm gonna go ahead and I'm gonna pull down his eyelids so I can look at his sclera. Okay, your sclera is white. I'm going to go ahead and I'm going to take my pen light and I'm going to go ahead and I'm going to shine the light into your eyes, okay? I'm going to use this as my pen light. I do not have my pen light available, but I'll be using a pen. Checking in both eyes. Okay, good. Now I'm going to have you go ahead and I'm going to have you look at my pen. What I'm going to do is I'm going to, without moving your head, I'm going to have you look at my pen, and then I'm going to have you look at the light fixture and then back at my pen, okay? Okay? Okay, good. Okay, that was good. Okay, my patient's pupils are equal and reactive to light and accommodations, okay? I'm going to have you go ahead and, I'm going to go ahead and look at your nose. Sorry, I'm going to go ahead and look at your nose, okay? Nose appears symmetrical. I'm going to go ahead and I'm going to gently palpate your face and your sinuses, okay? Sinuses do not appear to be inflamed or swollen. I'm going to go ahead and I'm going to take my pen light and I'm going to go ahead and I'm going to shine it into your nose, or I'm going to shine it into his nose so I can check his mucosa, okay? Go ahead and lean your head back a little bit. Okay, my patient's nose is moist and intact. The septum is midline. Okay, can I have you go ahead and place pressure on the left side of your nose so I can go ahead and evaluate the breathing out of the right side? Perfect. I'm going to have you do the same to the right side. Okay, good. My patient's nose appears to be patent. I'm going to go ahead and I'm going to take a look at your lips, okay? My patient's lips are moist and intact. Can I have you go ahead and open your mouth for me? Teeth are intact. Oral and vehicle mucosa are intact and moist. My patient's palate is upwardly movable. Next, I'm going to go ahead and I'm going to take a look at your ears, okay? So go ahead and look to the left for me. Okay, look to the right for me. Okay, so my patient's ears are intact and does not seem to have any drainage. So moving on, I'm going to go ahead and I'm going to gently palpate your lymph nodes, okay? There is no appearance of swelling or inflammation. Okay, so next thing I'm going to do is I'm going to go ahead and I'm going to evaluate your trachea, okay? You shouldn't feel any discomfort or anything, but if you do, please let me know. My patient's trachea is midline. Okay, so next I'm going to be checking for my patient's jugular, your jugular vein distension. So what I'm going to do is I'm going to have you go ahead and look to the left again. Okay, go ahead and look to the right. Okay, I'm going to check the left one more time. Okay, there is none. Mr. Pitts, I'm going to have you go ahead and move your head around, okay? So can I please have you look down? Okay, go ahead and look up. Okay. Okay, go ahead, look to the left. And then one more to the right. Okay, good. My patient has full range of motion in his head, in his neck. Sorry. Okay, Mr. Pitts, now I'm going to go ahead and I'm going to listen to your lung sounds, okay? Okay. Okay, I'm going to do the same thing to your back. Can I please have you go ahead and sit forward for me? Okay, my patient's lung sounds are clear in all lobes with no adventitious sounds noted. Looking at my patient, he doesn't seem, looking at my patient, he doesn't seem to have any adventitious sounds noted. And he doesn't appear to have any labored breathing. His chest rises and falls symmetrically, and there are no axillary muscles used. So next what I'm going to do is I'm going to go ahead and I'm going to listen to your heart, okay? Okay, my patient's heart sounds are rate and rhythm are regular. Next I will be feeling your pulse, okay? So I'm gonna go ahead and have you relax your hands on your legs for me. Okay, can I go ahead and keep your legs up? Okay, so my patient's pedal pulse is +2 bilaterally. Can I go ahead and have you put your feet together for me? I'm going to go ahead and check my patient's pedal pulse. Okay, I'm going to check the other one. Okay, perfect. My patient's pulse is +2 bilaterally. Can I go ahead and have you place your hands out for me? I'm going to gently pinch your fingertips, okay? This shouldn't hurt or anything like that, or if you feel any discomfort, please let me know. Okay, my patient's upper extremity capillary refill is less than 3 seconds. So next I'm going to do the same thing to your toes, okay? Okay?
Yes.
Okay. Okay, my patient's lower extremity capillary refills are less than 3 seconds as well. Next, I'm going to be checking your abdomen. So can I please have you go ahead and lay down flat for that, please? Okay, we're looking at my patient's abdomen. I don't see any distension. Okay, so I'm gonna go ahead and I'm gonna listen to your bowel sounds. Okay. I'm gonna listen. Okay, my patient's bowel sounds are active in all 4 quadrants. Next, I'm going to go ahead and I'm going to palpate your abdomen, okay? Please let me know if you feel any hurt or discomfort, okay?
Okay. No. No. No.
Okay, my patient's abdomen is soft and not tender. Can you please tell me when your last bowel movement was?
Probably this morning.
Okay, so my patient does not have any tenderness in his stomach. It is not in his abdomen. It is nice and soft. There is no pain, and my patient has stated that he has had a bowel movement earlier this morning. Okay, so the next thing I'm going to do is I'm going to examine. The next thing I'm going to I'm going to move on to the next exam. Okay, can I have you go ahead and sit at the edge of the bed for me, please? Okay, so now that I have you sitting at the edge of the bed, what I'm gonna have you do, what I'm gonna be doing right now is I'm gonna be assessing for your range of motion, okay? Starting with your arms. Can I have you go ahead and I'm gonna have you lift up your arms, and then I'm gonna have you go ahead and I'm gonna have you move them around in a circle. Okay, I'm gonna have you go ahead and bring them in front of you just like this. A little bit like this. Okay, so I'm gonna push on your arms. Don't let me, okay? Don't let me push you over. Okay, good. Let's see. My patient's arm has full range of motion and strength bilaterally. In his upper extremities, that's what I would say. In his upper extremities. So I'm gonna go ahead and I'm going to do the same thing to your legs, okay? So what I'm gonna have you do is I'm gonna have you go ahead and I'm gonna have you lift up one leg at a time. Go ahead and lift up your leg. Okay? Go ahead and lift up keep it up for me. Go ahead and lift up your next leg. I'm gonna push them down, okay? But don't let me. Don't let me. It's because you wanna be. Okay, good. Okay? My patient has full range of motion in his bilaterally in his lower extremities, so he has full strength. Okay. Okay, so full range of motion and strength in your lower extremities. Okay, so now the next thing I'm going to have you do is I am going to, actually I'm going to do the same thing with your ankles. So I'm going to go ahead and have you lift up your legs again. Sorry. Both of them? Okay, I'm going to have you tilt your legs, your feet down, your ankles up in a circle. Perfect. You can go ahead and relax those. Okay, so my patient does have full range of motion and strength in his ankles. Okay. So next thing I'm gonna have you do is I'm gonna have you go ahead and stand up for me. Okay, so what I'm gonna have you do is I'm gonna have you go ahead and I'm gonna have you bend all the way over and touch your toes. Perfect. Go ahead and stand up for me. Okay, do you feel lightheaded or anything like that?
No.
Okay. So my patient has gone ahead and touched his toes, came back up, and does not have any lightheadedness or anything like that. So what I'm going to do is I'm going to take my hands and I'm going to press them against your chest, okay? Do not let me push you over, okay? Okay? My patient does have full strength in his back. So the next thing I'm going to have you do is what I'm going to have you do is I'm going to have you take a couple of steps around this area right here. Go ahead. So I can watch you walk. Okay. You can go ahead and have a seat. Okay. So after watching my patient walk, he has a good sense of gravity. A good center of gravity, and has coordination. His coordination is steady and well balanced. Can I have you go? I know I asked you a little bit earlier, but can I go ahead and have you confirm your first and last name?
Yes, Curtis. Like 11387.
Okay. Can I also have you tell me where you are?
I'm Nassau.
Okay. And then, do you know what month we're in?
Yes, we're in July.
Okay. My patient is A&O times 3. If I were to rate this on the Glasgow Coma scale, he would be at a 15. What that means is his eye response and verbal and his motor response are fully intact. Okay, I am finished now. So I'm now finished with your head to toe assessment. So if you would like to lay back in bed, or if you would like to sit where you are and get comfortable, that is totally fine. Are you comfortable with where you are?
Yes.
Okay, so my patient is comfortable with where he is. So the next thing I would do is I would remove my gloves. I would discard them into the waistband, and then I would perform hand hygiene. So I'm going to go ahead and I'm going to toss those, perform hand hygiene. And then the next thing I would do is I would provide my patient with education before I leave the room. Thank you.